Hi there, everyone. Naj and with you, ACSA Senior Director of Marketing and Communications. To my right, ACSA Senior Director of Policy and Governmental Relations, Edgar Zazwata. We welcome you to a special edition of the ACSA Legislative Lunch Break here on a Thursday. We bring you information today on the governor's new stay-at-home order. Edgar, I know that you and your team have been collecting as much information, but as before we give some details, the governor, as I understand, Edgar, is just wrapping up his news conference and talking to reporters. That is correct?
Yes, we apologize to Governor Newsom for stepping on his broadcast here for a couple seconds, but it sounds like he's taking his last question here. And from the looks of it, just from the folks joining us, it seems like obviously a popular topic today, and our efforts, even as we are getting the information real time, I think our goal today is just to try to be translators a little bit, right? As we always joke that those noon press conferences, today was a little afternoon and we're not on a Wednesday, but we were hoping that we can offer a little bit of clarity on some of the issues that are coming up here as the governor announces some new information that will impact, frankly, all of us and our schools.
Yeah, clarity is the most important thing. We'll give you details in literally 10 seconds, but we want to let our viewers know that this is a live and interactive show. If you have questions, if you have comments, go ahead and drop them in the chat section. Tell us where you're watching from, what's happening in your school district today. Okay, let me go through some of these particulars from the governor today. New state of stay-at-home order announced today beginning the noon hour in regions where rising COVID-19 cases are overwhelming the intensive care capacities. Residents will be directed to remain in homes for anything other than essential activities. Here is the trigger point for this. If ICU capacity drops below 15%, then the regions go into a stay-at-home order for a minimum of 3 weeks. And when we talk about the regions, the administration has broken the state down into 5 regions, and they are Northern California, which extends up to the border, Greater Sacramento, San Joaquin, the Bay Area, and then Southern California, each representing a specific population. Once a region falls under that 15% threshold, they will have 2 days to comply and follow those rules, as we mentioned, for at least 3 weeks. As part of the order, no gathering for residents, playgrounds, salons, restaurant dining must close. Takeout orders allowed. You can visit your doctor and purchase groceries and participate in distance outside activities, exercise specifically. Retail must operate at 20%. A reminder for everybody that 52 of the state's 58 counties are now in the purple tier, which is the most restrictive tier on the blueprint for a safer economy, which is 99% of the state. I'm going to have our executive producer, Michael Kelly, go ahead and put up a graphic for us, the region capacity slide that we were able to get from the governor's presentation. There you go. You can see it right there. That gives you a projection of when these 5 regions will move into that 15% ICU capacity. Just of note, because Edgar and I and our next guest are here in Sacramento, we want to just let you know, according to the Sacramento Bee, reporting by Tony Bischak, the great reporter over at the Bee, Sacramento region is currently at 24%, and the administration believes we could hit that 15% number. According to the Bee's reporting, by Christmas Eve, you can see those other 5 regions there where the expectation is from the administration that those are the projections for when those regions could hit that projected capacity. We'll bring in some additional quotes here and there from Mark Galley and Governor Newsom in just a moment. Edgar, we'll bring you back live on here, and let's go ahead and bring in our executive director, ACSA executive director, Wes Smith, who has joined us today from his studio over in Placer County. Wes, so good to have you on the show with us today. Let me just ask you your initial thoughts. You have been watching this, as obviously so many educators, so many education leaders in the state. Your initial reaction to the governor's news conference and the stay-at-home order.
Yeah, thanks, Naj. Before I answer that, let me thank you. I feel like the local mom and pop retailer that got invited to meet with Macy's. You know, we do a small little bit every Monday night on Common Purpose and get about 30 or 40 really, really cool people that jump on. We've got over 220 people, I think, watching this live. So I want to thank you, seriously, you and Edgar and the team for the work that you do. Yeah, so I think the message for me right now is don't overreact. As is always the case with the governor's announcements, things are changing by the minute. Clarifications are coming out. I think, Naj, you'll want to jump into some of those, so I'll wait. But I think that's the message is, don't overreact yet. Give us some time here to sort through these things and even leverage maybe some things that the administration wasn't willing to do in the precious moments we believe we have before this is enacted.
And you know what, let me, and Edgar, we'll come to you in just a moment. Let me go ahead and just give a couple of quotes that came out of the news conference today from the governor. Gavin Newsom saying, quote, "We are at a tipping point in our fight against the virus, and we need to take decisive action now to prevent California's hospital systems from being overwhelmed in the coming weeks." And he called this the bridge to get us to January. And then Health and Human Services Secretary Mark Galley said, quote, "This targeted action will preserve vital ICU beds for people who need them, whether they're COVID-19 patients or someone who has suffered a heart attack or a stroke." Edgar, let me just ask you your initial reactions. Wes is absolutely right. Patients and let's pause a little bit. Let's take a breath. Edgar, I would ask for your reaction as well as you've been watching this.
Yeah, as we've been reporting all week, obviously, given our membership, given the thing that we were looking out for the most, and we talked about this at great length yesterday with our guests. We put out a message earlier this week of our anticipation of what was going to come out in the update today, and how is it going to impact schools, right? That was we were very much focused. While we care about the other parts, and we understand that this impacts families and our communities in so many different ways. Trying to do service to our membership, going back to just set the context, we had reported all week that we didn't anticipate that the announcement today would impact schools in the way of forcing them to close, even if you were in a region or in a county that had to go into a stay-at-home order. So essentially, if you were already operating, you can continue to operate. So that's what we were looking for. I know there's a little confusion there, and we'll get into this. Wes could take us a little bit behind the curtain in terms of what transpired in the last hour. But the bottom line, it is the status quo. It is, as we were reporting, that schools that have been operating can continue to operate. And I know we're going to get a lot of questions about the particulars of that. And this is the waiver this is the slide that created some issues. So some people are going to talk about this one. This said schools that have received the waiver can continue to operate. We quickly got clarification that was not the case. It's schools that are open can continue to be open. So basically, you had the authority to open, whether that be because you were open before your county went into purple, whether that means you had a waiver, whether you were doing small cohorts. It's a status quo is the bottom line. And I think for us, that's the biggest takeaway. And I know Wes will have something to add on that front.
Yeah, and Wes, this is something that you've talked about for several weeks now, because we have ACSA talked about the importance of students back in the classroom, how important it is, because we know that's the place where our students are going to have the best environment, the best learning environment. And you've really talked about the waiver system and small groups. Let's talk about that, Wes, the importance of those two particular things that school districts can do right now.
Yeah, absolutely. And let me clarify just for our membership that we understand that you have different realities in the field. That even if you know something might be in the best academic interest, you have realities, political and otherwise, resource realities, COVID rates for employees. So you have to make up your decisions based on your resources and what's best for your students and your community. And that's what we fight for. We fight not for either of the options, but for you to be able to use whichever option is best for you. If distance learning is working for you, if that's best for you, then we fight for your ability to have local control. Where Naj is taking us here, for those of you that have an interest and an ability to get back to in-person instruction, rumors started early this week about this stay-at-home order that we just heard. So this came from you. You reached out to us. We immediately engaged the administration and started to share your concerns, and learned early on that the administration did not anticipate this stay-at-home impacting your ability to bring students to in-person instruction. Whether you opened already because you were not in the purple, or whether you had a waiver, or whether you had small cohorts where you were bringing in some of your neediest student populations, all important activities if you're able to do them safely. And so we messaged you recently and let you know that it wasn't the administration's anticipation that this would impact that. And then we all tune in to the news brief and see the first slide, and it's missing more information that it has. My phone almost died from all of the buzzing from tweets from all of you. And so right away, and I think this is important for you so that you understand, when you message us, we reach out. We were able to share that we needed clarification. And during the press conference, we got this tweet from the administration saying that in addition to those of you who have waivers, those of you who have already opened can remain open. So you have waivers, this doesn't impact you. If you're already open, doesn't impact you. And right now, where we're pushing is for even more clarity around small cohorts. We absolutely believe that it is the interest of the state to allow cohorts as well. Else, why would they allow waivers in schools who are already open? But we're going to work hard to get that in writing, in a tweet, or somehow, so you have that in your back pocket. Again, we're here to advocate for you, for local control, for you to do what you think, in your professional opinion, is in the best interest, academic, social, emotional, physical, of your students.
And we want to remind you, this is a live and interactive show, as we do every Wednesday at 1 p.m. with the Legislative Lunch Break. Please jump in with your questions and your comments, no matter where you're at right now. Tell us where you're watching. I want to get to a question, and Edgar, I'm going to send this one over to you. This comes in from Dr. Drew. He asks, will this affect after school activities? I think that we are consistent in saying that there is some confusion. There is clarity that we're trying to bring to all of this, but can you address any of the after school activities piece?
Yeah, that one's a little less clear, and we don't want to speak too definitive until we go and get some clarity. I think that the advice here is, here's what's going to happen, as what's been happening throughout the pandemic. The state puts out guidelines. What you have to operate under is your local county's health order. So what each county, if a county falls into this tier, or a region in this case, and your county's in there, the local health officer is going to have to rewrite their public health order. And then they will specify what activities within the county are allowable or not allowable. This is a great question. Obviously, I know I wondered about this for my own kids, as a coach, like what is this going to mean? Here's the thing: they didn't spell out after school activities. They do talk about outdoor fitness classes that are allowed, but they also talk about limiting gatherings. So it's definitely in that gray area. I think it's going to depend on how this is clarified in the public health order. And again, what we've been saying, we say this over and over and over again, these are minimums. The state is putting out things that they're restricting. The county can go further than this. We were just having this conversation this morning. There's many instances where the county will say, look, we're actually going to restrict, and we're going to go stricter than what the state is recommending in this case. So we'll try to get more clarity on the after school activities and where on the spectrum that falls.
Yeah, and I think it's important for us to acknowledge to our viewers that we are still trying to get as much clarity as we possibly can, and we have our news teams and our GR teams that are working to get as much information as possible. If we don't have clarity to some of these questions, I want to make sure that we're giving you as much transparency as possible. I want to ask Anthony Ronnie's question here, because this is something that I have wondered since we initially heard about a possible stay-at-home order, and feel free, either one of you, to jump in with this. Anthony asks, what if a school is phasing in-person instruction? May the plan continue, or is it frozen in time? This is an important question because I know some districts have opened up their K-3 or their K-6, and we're getting ready to open up their secondary schools next week or something like that. So where's the discrepancy right now? Can one set of schools be open while the other can't, or how do they make that all work? I'm hoping one of you has some clarity to it, because that's a question that I've been asking for a couple of days now.
I think I'll take a stab, and then Edgar can certainly help us all where I misstep. But something he mentions quite a bit that's important is we have what the administration puts out, what the state puts out, and then we also have the interaction of local county public health. And we've seen instances where they have a stricter interpretation at the county public health level. So it's a bit of a loaded question. I'll say this, and this is not from the administration, but as we read what the state is doing, we believe it is their interest not to impact schools that are open, schools that are reopening per the blueprint. And so if you are opening and phasing it in and following that blueprint, we don't believe it's the interest of the state to halt that, to freeze that in place. And I think the tweet today, albeit brief, was alluding to that. Those of you who are open, who are reopening, those of you who have waivers, this isn't meant to impact you, to freeze you or otherwise. Edgar, how would you see that?
Yeah, I think you hit it on the head, Wes. I think that from every conversation we've had with the administration is that their intent, even as rates are going up, even as we're really in the worst place that we've been in the pandemic, they are trying to find ways to get kids into the classroom based on the science. And what the science has continued to show is for those younger students that with the proper precautions, that it is safe. So they don't want to close off. They don't want to close off those pathways. So I think that their intent is definitely clear. Again, we're going to be a broken record here. I think this is where county public health is going to have a role in how they're interpreting those guidelines and what ability they give you. We did get some indications this morning from the governor's office that there will be further information, even in addition to today's announcement. They're going to try to put some more information on waivers, potentially on testing, that there'll be something more in the next week to clarify what options schools still have available to them, whether they're in purple, even if they're in one of these regions that has been triggered to be at a stay-at-home order.
I want to go ahead
and Naj, can I
go
just mention too that as we're looking at these options, and this comes back to one of the questions you asked first, our advocacy, trying to protect not only the academic but the physical and social emotional needs of our students. This isn't the fault just of the pandemic. We know that our system didn't have the necessary social emotional supports historically, certainly recently, because of budget constraints, because of what we went through in the Great Recession. As people have been trying to ramp that up, we're still not there. The system hasn't had collectively the resources our students and families need relative to supporting their social emotional wealth and well-being. But then we come to COVID. It's also the holiday season. These are trying times typically for our families and especially our neediest students. And then we have this dynamic of school looking very, very different. And that's why we support as strongly as we can any of you who are trying to address that by bringing them in if you feel that that's what's in their best interest. And again, there's a lot going on here, but ACSA is absolutely advocating for your ability to support the social emotional needs of your students. And we understand that co-curricular extracurricular activities are a big part of that. We had CIF on a call today discussing just that.
Yeah, I want to refer actually to CIF because we have several questions that have come in, several comments that have come in regarding CIF. Edgar, we talked yesterday on the lunch break about CIF and their message that came out on Tuesday night about how, because of the changing COVID situation, that they didn't anticipate having any kind of guidance coming out before the start of the year because of things changing. Tom O'Malley asks a question. Victor Uribe asks a question. Greg Kemp throws in a comment there. But let me just go ahead and bring this to everybody. As Victor asks, it seems like they're not making decisions right now with CIF. That's not necessarily the case. But Tom asks a very important question. It is very rare that anyone in Sacramento address student mental health concerns. Obviously, with today's news, this is an issue, and it's going to get worse as we push school and activities out. Is ACSA pushing that message? Wes, you have been a leader in talking about social and emotional wellness, and this is a question that we talk about a lot at ACSA. We're student advocates. We put students first, and I just wonder, is there an opportunity beyond our members, our viewers going to the resource hub and picking up content from there? Is there something you as an education leader, as a student advocate, would just say as a message to our viewers about, hey, let's stay the course. Let's keep our focus on these students.
Yeah, well, we've tried really hard, Naj, you know this, to avail our members and anyone interested resources, free, almost always, that will help them prioritize these needs. We've had Arinda Education. We've had Dr. Cantor on. We've tried to make these things available, and there are some pretty important messages. And we can overthink it because it's difficult. We can also focus on some things that we know are tried and true. Relationships, routines. You've heard us talk about that, creating these relationships with our students, and that doesn't require in-person distance learning. There are ways you can do that with a phone, as Dr. Cantor pointed out. You can make phone calls, but these relationships with our students right now are more important than ever. Some routine, however that routine is for you, make sure that you're keeping that going, and then encouraging rest. I would just say to all of you, it's hard for you to prioritize the social emotional needs of your students if you're not prioritizing your own. You are selfless. You are concerned about everyone else. But again, if you can't show up to fight for them, to do the hard work that you're doing, then they can't benefit from that. So prioritize your wellness also. And rest is one of those 3 R's that they talk about.
Folks, for those of you who are just joining us, let me go ahead and reset the situation that we're in. First off, welcome to a special edition of the ACSA Legislative Lunch Break. We normally are on with you on Wednesdays, but we're here today following the governor's announcement of the new stay-at-home order that came around in the noon hour. Edgar Zazwata, ACSA's Senior Director of Policy and Governmental Relations, and ACSA's Executive Director, Wes Smith, with us here on the show. We'll roll some video from the news conference today as I give you some of these details. In regions where rising COVID-19 cases are overwhelming the intensive care capacities, residents are going to be directed to remain in their homes for anything other than essential activities. The trigger point here is if ICU capacity drops below 15% in a region, then there will be that stay-at-home order for a minimum of 3 weeks. Those are the regions right there. The state has gone ahead and broken up everything. The administration, rather, has broken it into 5 particular regions. Northern California takes you up to the border. There's the greater Sacramento region, the San Joaquin region, the Bay Area region, and the Southern California region, each representing a specific population. As you see the projections there, those are the projections that have come from the administration about when they expect those regions to fall below 15% ICU capacity if changes are not made. Now, if we hit that 15% threshold, regions will have 2 days to comply. It will be for a minimum of 3 weeks, the stay-at-home order. There are a number of stipulations for it. No gatherings for residents. Playgrounds, salons, restaurant dining, all must close. Takeout orders are still allowed. You can visit your doctor, purchase groceries, participate in distance outdoor exercise. Retail must be down to 20%. Again, a reminder that 52 of the state's 58 counties are now in the purple tier, the most restrictive tier on the blueprint for a safer economy. That equates to 99% of the state right now. I'm going through some of the questions.
I'm just gonna sorry to step on you here for a second. I'm just gonna clarify one piece here, just because as we're speaking, my phone is still getting questions about this. You know, even in the slide that we showed, and this was what the governor showed, and Wes told the narrative for anybody that joined late. Just to clarify, it's not just schools that have a waiver. I think they tried to clean this up with the tweet. Schools that are already open. So that means if you had an authority to open today, before this announcement, you can continue to operate. So that is any grade level. That means if you were already, that means if you were in the purple, in the red, fell back to purple, but are continue to operate, those schools can continue to operate. That also means if you have a waiver, you already have the authority to reopen. We were told that does allow you to continue with those plans. So I think just to underscore that, because I think that's been the biggest question of the day about what their intent was and what does this mean for those of us that had been able to open.
And we do have Deb Rowe from Stanislaus County who's brought in a question, and this is something that we talked with the reporter from the Sacramento Bee about yesterday about vaccines. She's asked, "Hi guys, I didn't see teachers on the 3 tiers listed for vaccine distribution. Can you find out any additional information for us?" I would ask either of you, do we have any updated information on vaccine distribution? Because we've heard there are 320 or so thousand vaccines that are making their way to California, will be available over the next few weeks based on if everything is approved by the FDA. Do we have information right now on distribution?
I could touch on that very briefly, and then Wes could give some context on how we're being represented. These are still preliminary recommendations. I know some folks probably saw the headlines on the national front. What's happening is there was a national CDC advisory committee that put forward the tiers. Educators weren't in that first tier, and that's the only decision that they've made. They haven't made any decisions about who comes next. There is a lot of discussions about putting teachers and educators in that second tier after healthcare workers, after individuals in nursing homes. So we do believe that there's an effort to prioritize those folks. Now to California, there's another group that the governor has put together, which I'll let Wes talk about our representation there. But that same conversation is going to be happening there. So the bottom line there is probably not in the first phase. But there is a lot of discussions about still making that priority in maybe that subsequent phase.
Yeah, and I would just add, we started with what's our initial reaction, and I said, don't overreact, breathe, we've got to be a bit patient. That absolutely applies here as well. Just to add some context, we saw the 3 tiers today. Deb was right, educators were not mentioned in there. My wife pointed that out too. She was watching it, and she was like, where are all of you? And I think this context was provided by someone at the state earlier this week that they're going to get about 300,000 doses initially. Pfizer requires 2 injections. They can treat right away 150,000 people. They have over 2 million necessary healthcare workers in the state. And so I think the numbers are so overwhelming in the beginning. That, as Edgar said, there are going to be other phases, but I think we're going to have to be very patient. I think it's going to take some time to ramp this up. It's great news that vaccination is on the horizon. We are seeing light at the end of the tunnel, but for it to get to education, I think the tunnel is a little longer than we might like to admit. But if we expect otherwise, I think we're going to be frustrated. And to Edgar's point, ACSA was asked to have a representative on a state task force to look at vaccine distribution. Our state president, Dr. Ron Williams, has been doing that for us. He's advocating, Deb, for all educators to be prioritized. That's his role there. As Edgar said, they really are following CDC guidelines, trying to adapt them here. Help is on the way. It's going to take some time to get to us.
Yeah, exactly right. And folks, you're going to have to bear with us as we are moving through these questions. There's been so many of them, and I want to make sure that we are getting to every single one as substantively as possible. So bear with me here because I'm working my way back to a question. Let's see. I don't believe it's that question. I think we already hit on that question. So folks, go ahead. Keep sending in your questions because it is obviously very important. Let me ask this question. David Figuli, who is watching us on YouTube right now, he asked the question, and Edgar, I'm not sure if we've been able to get this information yet, this clarity from the governor's office about will schools have to reduce their capacity to 20%. We talked about retail will have to drop to 20% of their capacity, which obviously means probably lines outside of places like the Home Depot and all of that. If indeed there is this stay-at-home order, are we hearing anything about this as far as schools that are currently open in some of these regions?
Yeah, and I'll give the caveat there could still be some of the details in the subsequent announcements. That's not a piece that we got. I mean, there's already restrictions, right? There were already the school guidance. Here's the bottom line. The school guidance that was in place remains in place. The industry guidance that you could see on COVID-19, and that was the message we've been given many times, that already tells us to limit capacity. That's already why so many of our schools that have been able to open are under hybrids or different iterations of that. So today's announcement, I think the bottom line for schools is that they can continue a status quo if you already had the opportunity to open. I think the 20% and some of the capacity limits that we're seeing, some of the exemptions that are being made under the stay-at-home order, those that can stay open have to limit capacity.
Edgar,
go ahead.
I don't think we can, draw too fine a point on this, right? For people that are maybe coming in later, that are still, worried and understandably so. Our understanding is that it is not the interest of the state to have this stay-at-home impact, as Edgar just said, what's already in place for public education. So again, that blueprint is in place. As we understand it, those with a waiver that's been approved can open. Those who are in the process of opening, again, so long as they meet the criteria of the blueprint, can open. Bringing cohorts back, we still believe that's absolutely appropriate, and you can do it. That has not changed with the stay-at-home order. And as we said at the beginning, we're going to work at that in writing, not only so that you have clarity, but we know you're going to have questions in your local political dynamics. And we know that it helps to be able to take something official and say, here it is in writing. So we've got the waiver in writing. We have the reopening in writing. We're going to work on the cohorts. But I think, as Edgar said, the blueprint is still in play as far as any of us know. And we believe that's the intent of the state moving forward.
I'll just add a little bit to that, Wes. I know I've lost track. I think it was Alan. We've gotten so many questions and comments. But in a similar vein, in terms of what about schools that are phasing in? What if they started to open and they didn't, but they are still in that process? I think the same answer would apply here, that the intent that they've told us is that schools can continue on with those plans. Again, I'm going to be a broken record. This is where it's going to look. We have to work with our county, our local county public health, because ultimately they're going to be the ones to make the call. The state is likely not going to intervene in those type of cases. They're going to deem, okay, if you were already quote unquote open, that sounds like you're open. I know we got the question earlier as well. What if you're in a school that is currently in a quarantine? You were open, but you had the cases. You're still technically open. You're going back to your reopening plans. Their intent is that those schools can continue to operate. But again, we're going to have to work with local county public health officials to make sure that that's being interpreted the same way across the state.
Yeah. Hey, Naj, let's, this is the message, right? I mean, this is why people are tuning in today. Edgar just said 3 really, really important things right there. Okay. One is that things can change and they often do. Things can change. 2, you've got to work with local county public health because some read things differently and have stricter interpretations. We've seen that around the state. The third is what we've been saying, that this is not intended, the stay-at-home is not intended to impact the reopening or the continued in-person instruction of schools. In fact, I've had a conversation with folks at the state level and asked that question. What if a district is in the red, they have a plan to reopen, they haven't reopened, does it impact them? And they said, it's not anticipated because it isn't our intent to impact the process of schools reopening. So that's what we've heard multiple times. That could change. Counties may see it differently. But I think it's important, anytime you want to ask that question, in our minds, take the stay-at-home order away from the equation. Because again, if it's not intended to impact school reopenings, it only confuses the conversation. If the intent of the state is ultimately realized as we clean this mess up a little bit.
I do want to remind all of you that are watching, first off, thank you for watching. I believe we have almost 300, if not more than 300 people who are currently watching live, and we appreciate you being here. We do want to tell you, like and follow us on Facebook if you're watching us on Facebook. If you're watching us on YouTube, subscribe to us. We have such a good time on Wednesdays at 1 o'clock during the ACSA Legislative Lunch Break. Those of you who are seeing us for the very first time, mark it in your calendar, 1 o'clock on Wednesdays for the show. Edgar, you have some new data that has just come in response to the stay-at-home order, the information, and one of the questions. Is that correct?
Yeah, I'll try to hit a couple questions here that we've seen in the comments. One is, where can we find this information? Which is a great question. Our understanding is that the state will publicize this all on their COVID-19 website. So as part of the blueprint, you will be able to go there and see what's the status of your county or your region at any given time. Obviously, since we're on live, I don't know if that's actually happened, but we're being told that that will happen. But here's a quick snapshot, since there's only a couple regions. I know people were asking about where do we stand now. So California statewide, the current percentage of ICU beds is 75. In the Bay Area, which is the best area in terms of numbers, they're at 72%. So that's saying something when the best one we have of the regions is at 72%. Greater Sacramento, as Naj talked about, 76%. So they only have 24% capacity left. Northern California, 85%. San Joaquin, 78%. And Southern California, 74%. So every single region, maybe with the exception of the Bay Area, is projected to meet that threshold in the next couple of days or in the next week. So it just goes to show that it's a regional approach, but right now it's looking like most of the counties, most of the regions in the state will ultimately be impacted. And right now the state is projecting that essentially by early January, every county will have met the threshold of having less than 15% of their ICU capacity.
And let me
just
Naj,
our members are getting used to things changing. Here again, we want to make sure you're clear. We used to look at infection rates, and now we're looking at ICU capacity. It's a different metric. It's a specific metric for this stay-at-home order. Yet another thing for us to monitor.
Yeah, you know what? You're exactly right, Wes, because we have been looking at different data points because the governor has talked many times about all the decisions are going to be driven by data. And the statistic before we saw this one come out today, California reported 20,000 new COVID-19 cases on Wednesday, just yesterday, 20,000 new cases. But now we hit this other data point today about the projections and going below that threshold, that 15% threshold for ICU capacity. You can see right there, that is the designation. Those numbers are coming in from the administration about when they anticipate all of these 5 regions, which span the entire state, will go into that threshold, go below that threshold, and then launch into that stay-at-home order, which will trigger a 3-week stay-at-home order, at least a 3-week stay-at-home order, and give each of those regions 2 days to comply. You know, there's a really great comment that has come in, and now I'm losing. Here we go. From Victor Uribe, he says, "Let's keep our sanity as changes continuously happen. Learn, unlearn, and relearn." Wes, it's almost word for word what you're just saying about how things are changing, and every time we learn something, we have to think about something completely different. I would ask you then, I know you like to ask this question, so I'm going to ask you this question about hope. What brings you hope as we move into these next 3 weeks to end the calendar year, and then move into that January timeframe? Because the governor said today, these new data points, this new stay-at-home order, whenever it happens, if it happens, is a bridge to get us into January. What brings you hope right now?
Yeah, Naj, thanks for the question. I do love the question. I have to say to Victor, it's so nice that our members are so much more intelligent than we are. His words are so much better than mine. 2 things I want to share, Naj, that give me hope. I don't want it to seem like we're ever being critical of folks trying to do the best they can. The administration has changed the metric, but it's because they're worried about the loss of human life. Our governor is concerned about not being able to treat the neediest patients in our state. And I understand that, and I value that. It also gives me hope that our governor has prioritized education, didn't have to mention it, cares about our students, where they are. And I get, we can be critical of how it's happened. It's easy to do. But I'm saying we do have a governor, an administration that really, really cares about students, and in particular, their social emotional well-being right now. What gives me most hope, though, is our members. We have almost 400 people that changed their schedules today to get on a webinar, to figure out the resources they have to meet the myriad of needs in their community. I always wake up inspired by and hopefully encouraged by our members, by their strength, by their conviction, and the numbers tell that tale yet again today.
Yeah, thanks, Wes, so much for that. We will get one more question in before we close out this special edition of the ACSA Legislative Lunch Break. Edgar Lindsay Lopez asks a very good question about, and we talked about changing data points and new things to look at. Now that we're looking at these ICU data points, are we still paying attention to the color tiers? And I think that's important because we've spent so much time looking at the blueprint for a safer economy. Now we're stuck looking at some other type of data point. Do we still pay attention to what we've been paying attention to for weeks on end?
Yeah, I can appreciate Lindsay's question because I'm with you. I'm feeling you on this. I was like trying to keep track of the different methodologies. I feel like at one point or another, I became a pseudo expert on one or the other. We went from county monitoring list to the blueprint to now this new system, which I'm sure we'll know way more about tomorrow than we did today. Here's the bottom line. Yes, the blueprint for a safer economy still persists. As the governor stated, and I think it's important, I love what Wes had to say because I think it's important to end on a positive note, even if we're in this state right now. And it by all accounts, it's going to get tougher. You look at these ICU rates, they're going to get worse. It looks like they're going to get worse. We obviously have a say in that. I think what all of our individual actions, our community actions will play a part there, but it's going to get worse before it gets better. But with that said, there is an exit strategy as well. Even with this new system, as you're into the regions and you met the 3 weeks and then they're going to assess what the projections are. Here's the thing, the state officials, the public health officials have learned essentially that about 12%, I believe, of COVID rates, transmission rates at any given time will end up in the hospital. And of that percentage, about 30% of those folks are going to end up in the ICU. So that because we've been doing this for 9 months, they have a way to make some of those projections. So the idea is that when somebody is going to exit out of the system, then you go back and they're placed back into a tier. So probably in a purple tier, and those the guidelines that we all have become familiar with under the purple, red, and so forth will continue to be applicable. Now, the one thing that the governor talked about and spent a good amount of time talking about vaccines is that they expect that this is going to be the last surge. That given that we're literally days, weeks away from folks getting the vaccine, that they do expect that we will be on an upward trajectory and that we will have more counties trying to, who potentially will get out of purple and back into the red, and will, that map will change. So yes, we were not abandoning the blueprint. When a county gets out of that tiered status, they will then have to still, all their decisions in terms of school reopenings or what's available to that county will be per the blueprint.
Hey, Edgar, I think it's helpful to really simplify things for our folks. Tell me if you disagree with this. To Lindsay's question, I would say if you're looking to get a new pair of shoes, and you want to go try them on in the store, pay attention to the ICU rates. If you're looking at reopening schools, pay attention to the blueprint. The distinction we're trying to make here is that this stay-at-home order and the metric of the ICU beds is not intended to impact school reopening, those schools who have opened. That is per the blueprint. How would you nuance that so that I don't mislead our members, Edgar?
No, I think you're accurate there. I think I don't know that I would add any piece of that. I know it gets really confusing with these different iterations. And somebody asked the question earlier, and I think it's worth coming back to this. There is going to be further information, I think, hopefully to clarify, and we'll have a role in this in terms of what options our members and our schools have available to them, even in the state, even as if they're in the stay-at-home order or in the purple tier. Now, we give the caveat always to the governor's office that, yes, at the end of the day, we need to get sign-off from our labor partners, and there's challenges on the local front, but that there will be hopefully some clarifications. Even the question of, can we get a waiver? Can we get a new waiver? If I'm in an elementary school that doesn't currently have a waiver, am I able to apply and get one at this time? And so we've been told that there will be more information coming forth in the next week on that front.
And let me just go to a couple of comments here as we wrap up, because I want to make sure that I do that. Victor Uribe, who's been a really, really good participant here today, says, look, we haven't even hit the Thanksgiving surge, so scary times. Mary Lim says something that I think is incredibly important. Keep wearing masks, everyone. We can stay vigilant and survive this. I do want to just leave on one last comment here from our great member, Don Austin, who's the superintendent at Palo Alto Unified. He's been a guest on our Wednesday show. He says, hope is our only option right now. Head up. I would tend to agree with that, Wes. Edgar, I would agree that we do need to maintain some positivity as we move forward over these next couple of weeks.
Well said.
Absolutely. Absolutely.
All right. Thank you, folks, very much for joining us on this special edition of the ACSA Legislative Lunch Break. Don't forget, we have this show for you every Wednesday, 1 o'clock. Edgar and I, and maybe Wes will grace us with his presence next week when we have some more fun and break down some more of this information. Guys, have a good rest of the week. It's going to be I feel like it's going to be a really busy rest of the week, even though tomorrow's Friday. Folks, thank you so much for watching. We'll see you next Wednesday here on the ACSA Legislative Lunch Break.